Sex as a vital sign. Genitals and health. You ever wonder why your doctor doesn't talk to you about sex? Here's something most people don't realize. Your sex life is a direct reflection of your overall health. What if I told you that your genitals could give clues about your heart, your hormones, and even your nerves? Let's dive into why sex should be treated as a vital sign in healthcare. Think about it. We get our blood pressure checked, our cholesterol levels monitored. But what about our sexual health? It's just as important, yet rarely discussed in doctors' offices. Today, we're going to uncover why sex isn't just about pleasure, it's about survival. Stick around, because this could change the way you view your health forever. Here's the issue. Millions of people suffer from chronic health conditions like diabetes, hypertension, and depression. Conditions that don't just affect how you feel day to day, but they can also completely derail your sexual function. But no one is talking about it. Why? Sexual health is a taboo topic, and most doctors avoid the conversation altogether. But here's the thing. Ignoring sexual health is ignoring a critical part of your overall well-being. How often has a healthcare professional asked you about your sex life during a routine checkup? For most people, the answer is never. Yet, sexual dysfunction can be one of the first signs that something is wrong with your heart, your hormones, or your nerves. So why aren't we paying more attention to sex as a health indicator? And more importantly, what happens when we do? Let's break this down. Sex is a complex process that involves multiple systems in your body. For you to enjoy a healthy sex life, your blood vessels need to dilate properly, your hormones need to be balanced, and your nerves have to be firing on all cylinders. If any one of these systems is out of whack, guess what? Your sexual function is one of the first things to go downhill. Take diabetes, for example. Did you know that men with diabetes often experience erectile dysfunction, ED, earlier than men without the condition? It's because high blood sugar levels damage the blood vessels and nerves responsible for erections. This isn't just a minor inconvenience. It's a warning sign that something more serious is happening in your body. And it's not just men. Women with diabetes can experience decreased arousal, vaginal dryness, or difficulty reaching orgasm. These issues often go unaddressed because, let's face it, most doctors don't want to bring up sex during your diabetes checkup. But they should. Sexual dysfunction is like the canary in the coal mine. It can warn you about bigger health problems before they become life-threatening. So why should sex be treated as a vital sign? Because it's a powerful tool for diagnosing and managing chronic conditions. Just like we monitor blood pressure or blood sugar, healthcare providers should be routinely checking in on sexual health. Not only does this give a more complete picture of a patient's health, but it also opens the door to better care. Think about it. Let's say you're a man in your 40s and you start experiencing erectile dysfunction. Instead of just prescribing a little blue pill and calling it a day, your doctor should be looking deeper. ED can be a sign of early heart disease, clogged arteries, or even high cholesterol. Addressing the underlying health issues can prevent a heart attack down the road. For women, things like low libido, pain during sex, or trouble reaching orgasm can be linked to hormonal imbalances, chronic pain conditions, or even mental health issues. Addressing these problems isn't just about improving sexual satisfaction. It's about improving quality of life. This is where things get real. When doctors start asking about sex as part of routine checkups, they unlock the ability to treat patients more holistically. No longer are we just treating symptoms. We're treating the person as a whole. When we treat sex as a vital sign, we open up the conversation to better health outcomes. It's not just about the bedroom. It's about your heart, your hormones, and your overall well-being. Chronic conditions like diabetes, high cholesterol, and depression can all wreak havoc on your sex life. But more importantly, they can endanger your long-term health if left unchecked. And here's the kicker. Patients aren't going to bring this up on their own. It's up to healthcare providers to start the conversation. If you're a patient, don't be afraid to ask about how your health affects your sex life. If you're a healthcare provider, it's time to normalize these discussions. Sexual health isn't a luxury. It's a window into everything else going on in your body. The sooner we start treating it that way, the better off we'll all be. If you found this video helpful, don't forget to subscribe and check out our next video on the surprising ways your gut health affects your mental health.